Hello parents, good afternoon. I hope everybody has joined the session. Hello parents, good afternoon. This is Dr. Lalit Mittal from Giggles Clinic and on my own space. So today we'll be discussing about biomedical interventions in autism and what does the evidence say. Now the purpose of today's webinar is, most of us know what are the various interventions are there, but the purpose of today's seminar or the webinar is basically to know what does the research say, what is the evidence about the various biomedical interventions which are available for autism. As such, there are a lot of interventions. We can search on the Google, we can search on the net. We have lots of information available through the social media and as well as the experiences of the other parents. So the purpose is to discuss what are the various possibilities and what does the evidence say, how harmful or how safe they are for our children. So we'll be beginning with the presentation now. So basically, first of all, we should know what is biomedical treatment or biomedical intervention. See, the word biomedical basically means biology or the biological and medical. And basically in the field of autism, the purpose is we know that in autism, the defect is not only in the functional behavior. The defect lies at the level of the physiology. Physiology means how the cells are functioning, how they are modifying, and how they are giving response to our treatment. We know that in autistic kids, we must have gone through these words. There is mitochondrial dysfunction, there is redox potential defect, there is a lot of oxidation stress. So these are the words which we typically use it at the cellular level. So the purpose of this biomedical treatment is to act on these levels and to rectify these physiological processes or the changes which are occurring at the cellular level. So the ultimate purpose is not only that it will help in simply modifying the functional health, but also it will provide the optimal health. And we know that research, with a lot of research and evidence has gone with the children, and we know that the gut brain axis, we have discussed a lot about gut brain axis in our forum and as well as in the webinar, that and it has been proved well beyond doubt that the gut brain axis is play a potential role in modifying the behaviors in autism, the aggression, the hyperactivity. So the purpose of this biomedical treatment is another important is that it typically acts on the gut and thereby modifying those functions of gut tissues and thereby improving the gut brain axis. And as a result, the behavior in the form or the behaviors in the form of aggression, hyperactivity, restlessness can be improved. As such, there is no medicine or there is no treatment which is acting directly on the core features of autism, but the purpose is that they'll be indirectly modifying the various other processes which are hampering the brain processes and thereby affecting the behaviors in autism. So this is how a child is functioning not meaningful progress. And we also know that if we are not able to act on these cellular processes or the chemical events which are taking place in our body, no matter whatever best treatment we give, either from America or Canada or India, whatever best treatment we may give, the child will not able to show the improvement in academics, learning, cognition or behaviors unless and until we act at the root levels. So the purpose of this biomedical treatment is tries to act at the root levels where the cause is lying, thereby rectifying the further problems. So now, what is the prevalence of this biomedical intervention, or we call it as biomedical treatment, BMT in ASD? See, there was a research, or there was a survey which was done by National Health Survey in US, that in 2007 the ratio was around somewhere between 11 to 12%, and that ratio more or less remained same till 2012, over a span of 5 years, in the range of 11.6 to 12%. That means there was neither an increase nor decrease. Now, it is a good thing that there was not a decrease. That means the faith of the parents or the professionals from this is there. It's not that they are thinking that no, it is not affecting our kids and it is somewhat different, it is harming, there is no much effect. Probably why there has not been gain in this is because the cost is very, very expensive. Obviously, if we compare the United States, if we compare abroad, the cost of biomedical treatment is quite expensive. It is 3 to 4 more times expensive than India. So probably this is the main reason. And another thing is that if you go in the India, the percentage of parents who are opting for this BMT is more than 40%. Another thing is that why this, probably this percentage would have been more. Actually, this percentage would have been more than 50%, because more than 50 to 60% they are opting, but they are not able to continue with that treatment because of the cost issues. Cost issues are the most major hindrance for giving BMT in India, especially because higher socioeconomic people who are well-off families, they can afford. But we know autism is no such that it can affect the low socioeconomic or higher socioeconomic. It can affect any person irrespective of the age, irrespective of the ratio is 4:1. That is, for one girl, 4 children, four male children are affected. So this is what the prevalence. Now, why parents are opting for this biomedical treatment? See, the major reason is that we all know that there are two to IFDA, that is Food Drug Association, which has Food Drug Administration, which has approved the drugs. These are mainly of two types, that is antipsychotic drugs and CNS stimulants. We know antipsychotic drugs, these are only of two, risperidone or aripiprazole. Aripiprazole, we all know, and sometimes we can give arcamine for giving aggression, that is clonidine. They are very well known that what are the side effects, how dependency it increases over a period of time if the child is continuing. No doubt, for the initial 5 to 6 parents, the child, everyone will be a very conducive environment will become. The parents will be happy. But the problem occurs after this 6 to 7 months of this guidelines on what is the dose have to be given. They could be as and then at that point of time we'll be thinking probably we would have not opted for this. But in say even less than 2% of the cases, we are bound to give these medications where parents are not able to help the child, where they control that. So I do, but the best is that we should avoid giving them. This slide, their main focus is acting on the gut-brain axis. And see, gut-brain axis is one of the topic of lot of research, and so much research is being done and lot discussing on the Google by other family friends or their relatives, those who have experienced this. Why? Because the physician is about these medications or the various, so they might not discuss of those treatments which are going. So majority of the parents, they will be start giving this without taking the advice of a parent, because most of us know that they are not, if they are not improving the symptoms, they would definitely not damage any or harm the problems in the child. So this is the reason why parents are being opting for BMT. What is this BMT compromise? See, this list of BMT is endless. There are a lot of things, and it is not possible in 1 to 1.5 hours to discuss each and everything. I have taken some selected topics which are very controversial, and there are a lot of so I'll try to discuss on those. And if any of the parent is having any doubt other than those, they can always discuss on the WhatsApp group, or at the end of the session we'll be discussing. You can type your queries. So we'll be discussing on these specific topics and some other topics which are now being tried and studied in this biomedical approaches. So special diets we have, then we have vitamins, we have minerals. No doubt there is a lot of discussion on vitamins, especially B6, B12, like minerals, calcium, zinc, food supplements. Yes. Then hormonal therapy. Most of the parents must not be aware of these hormonal therapy, but yes, oxytocin, melatonin. Most in this slide, but I'll just put a word of a few, say 1 minute on essential oils. Then others like music therapy and chelation and stem cell therapy. Stem cell therapy I've also not included, but I'll tell the bottom line what does the evidence say. So now I'll be coming up on these special diets now. So regarding the special diet, GFCF diet, everybody is very well aware of GFCF diet is gluten-free, casein-free diet. And another forms of this diet, if we go to the subclass of this, it is GFCF SF, that is, you can say sugar-free. Then you have SCD, which is known as specific carbohydrate diet. I'm just giving a short about this. I'll be discussing in detail about the controversial. If you have any doubts, we will discuss. SCD is a specific carbohydrate diet. Now, what does SCD means? SCD means we are introducing a specific type of carbohydrate, and that specific type of carbohydrate is a complex carbohydrate. Why we give complex carbohydrate? Because we know there are two types: simple and complex carbs. Complex carbs, they have less amount of sugar, means to say their glycemic index is low. We have also discussed about glycemic index so many times. So the sugar, we know that sugar is a very good medium for the yeast to grow. So in order to prevent the yeast overgrowth issues in autistic kids, we switch the child to SCD, that is a specific carbohydrate diet. Means to say we have to give complex carbohydrates only. And along with that, if we add a casein-free diet, that is avoid giving dairy products, then this is considered to be the one of the best diets, and it is rated even higher than GFCF diet in treating antifungals. So most of the biomedical plans which I am giving to my parents, and they have found really good for them, and they are following this SCD along with this diet, and they have found really good beneficial effects. So this is about the SCD. So what is complex carbohydrate? Complex carbohydrate includes most of the fruits and vegetables, and all the non-vegetarian diet. Another advantage of this, they are rich in B12 and B6. So this is about a short. I won't be giving in detail because we have discussed a lot about this. Then another is a ketogenic diet. Now, some of the parents are also going for, see, ketogenic diet is a diet. It is basically a low carbohydrate and high fat diet. Low carbohydrate and high fat diet. There is some misnomer. Some parents think that it is a high protein diet. No, it is a low carbohydrate, high fat diet, and which has been studied initially in epilepsies. Epilepsies means where there is recurrent seizures. And we know that autistic kids, they do have epilepsy, and the ratio is 25% of the ASD kids have chances of epilepsy. So 25% of the kids of ASD, they might get epilepsy. And this diet has been tried as a last resort, where when we are trying a lot of multiple drugs, anti-epileptic drugs, the parents are not able to find benefit. In that case, we have tried giving ketogenic diet. It has been found to be useful in epilepsy, but no role in treating core features of ASD. So then you have BED, that is body ecology diet. Now body ecology diet is also a type of GFCF diet. Here what we give, here also we give a gluten-free diet and casein-free diet. And in gluten-free diet, we are introducing, here what we give a coconut kefir. Now coconut kefir is basically act as a natural probiotic. Although it is not a probiotic, but it acts as a natural probiotic. It promotes the healing, gut healing. It helps in multiplying of the good bacteria. And along with that, we give a raw butter. Now, why we give, now the question is, parents must be thinking raw butter means casein. No, it is not it is basically a raw butter. Now, raw butter is something different which you get from the market. That is Amul butter. Those are ready-made butters. They have casein, but raw butter is the purest form of white butter which we used to prepare, our grandmothers or mamas who used to prepare at the home. That is taking out from the milk and separating it. That is the raw butter. It is 99%, 99.9% casein free. So along with this coconut kefir, we give this raw butter. Why we give this? Because both of them have a symbolic effect on the gut. So it helps in gut healing, thereby helps in maintaining the ratio of good and bad bacteria. Now, Nemec protocol, everybody knows about the Nemec protocol. Preferably, a Nemec protocol has 3 to 4 components. We give inulin. Other issue about Nemec protocol is inulin. What is the dose? Dr. Nemec has written the dose is 1/4 to half teaspoon, but according to what age, what we have to give. Then he prescribes, Dr. Nemec prescribes our equivalent extra virgin olive oil. Yes, definitely, that's very good because it is rich in omega. This contains linolenic acid and it is rich in omega-6, omega-3 and omega-6. And we know that they are helping brain function. Then another thing is that Dr. Nemec gives rifampicin. It is an antibiotic which specifically acts on the gut, and it is basically given for the priming of the gut, initially for 10 to 15 days. The problem is that I don't prefer, here Dr. Nemec uses inulin. Now I don't use inulin because inulin is a prebiotic, and what happens, unlike probiotic, inulin also promotes the bad bacteria. So the chances that along with healing the good, along with promoting good bacteria, the bad bacteria are also promoted in this. So that is why I don't prescribe on this. There is something called as low oxalate diet. Now, low oxalate diet, we'll be discussing what is low oxalate, when we have to give, when we have not to give. Rotation diet is basically means you are, suppose a child has gone for an intolerance test. Some of the intolerance levels are there which are not very high but in the medium range. So what we do, we stop that particular food product for a 3 months. Then again we try to introduce that after 3 months, and then again check how the body tolerates. If the toleration is good, then we again stop. Again we introduce. Again stop. Again. So this is means rotation. We keep on rotating it, and as a general rule and the guidelines, the rotation diet has to be keep on rotating after every 3 to 4 months. So this is about a short about these various diets. Now GFCF diet I have told. So now what does the evidence say? This is important for all of us so that we are not being basically, you know, supported by the false evidences and beliefs of others. So what does the evidence say and how safe it is? This is the important thing we should know. So the current evidence supports the use of GFCF diet with the gut issues or those we have intolerance to gluten in casein. So important thing is that why I have highlighted this slide and the point, because most of us, you know, the child is in autism spectrum, discussing with other parents, discussing with other family members, discussing with doctors, we start giving the GFCF diet to the child in spite of knowing whether the child has intolerance or not. And I've always, I've always stressed on this point that don't give GFCF diet simply if a child is on autism spectrum or the other parent is giving. You know, if you, there is a very good saying, if any of the parent must have, studied about this. If we meet one person with autism, we meet one person with autism. Means to say that no two persons in the spectrum will be same. They'll be totally alike, and you cannot have two children with same features of spectrum. That is why we always say each child, each approach will be different according to his behaviors, according to his symptoms. So go for this food intolerance test, and this is the this is the absolute indication if the food intolerance test shows reports abnormal, or if the child is having another issues of gut issues or this. So these are the two relative indications where we have to start with GFTF diet. And in fact, and another important thing, if we keep the child on remission diet without any known indications, then definitely his nutritional status will be hampered. Because no doubt, when we give GFCF diet, we also have to take into consideration his vitamin levels, his calcium levels, and mineral levels. This is very, very important, and it should never be given and without the guidance of a professional developmental pediatrician or biomedical doctor who is having sufficient knowledge about this subject. Ketogenic diet I have told and discussed. The ketogenic diet is an intervention which was used to use in epilepsy, and there is no studied literature or claims that it can be used in ASD, and there are no trials. So current evidence does not support the use of ketogenic diet in ASD. So now camel milk. Now camel milk is another controversial topic. That is why I have taken into this slide. Now why I am discussing about this camel milk. See, camel milk, we all know it is a casein free, and it has been recommended by most of the biomedical doctors, developmental pediatricians, because it is casein free. But important thing, what we have to know, that there have been a lot of studies which have been done in relation to raw camel milk or versus boiled camel milk or pasteurized camel milk. See, now during this episode, a pandemic of COVID-19, there are 3-4 parents of mine who have told me, and they were worried, sir, should we give camel milk? And I told, yes, why not? So they told me, sir, but camel milk contains this COVID-19 SARS and virus, and it can cause respiratory diseases and other illnesses. I told, yes, definitely, what you are telling is absolutely right. But that thing comes when you are giving raw camel milk. See, when you boil the milk, and when the milk is pasteurized, there is no chances of contamination. So no doubt raw camel milk is the best form of camel milk which you can give, because it contains all it contains all these immunoglobulins and various other factors which help in boosting the immunity. But does raw camel milk is more advantages as compared to its disadvantages? Yes, it is more disadvantages because of the presence of these viruses like respiratory illness virus, SARS virus. So that is why we always recommend go for camel milk, but it should be boiled, it should be pasteurized. Other thing is that it is very tough to get a camel milk because of the lot of contamination. So the best thing what we can do, if you are not able to find the pasteurized raw milk from the farm, we can go for frozen milk or the powder milk, because these are pasteurized ones. So, and a lot of RCTs and studies have done which have found that when they have given this camel milk to the children, they have found a lot of improvements on CARS. We know that childhood autistic rating scale, and this CARS contains of 15 parameters. Those children who are on the autism spectrum, and out of these 3 to 4 improve on the subscale, there was an improvement. And but definitely, as I've told, there is no supportive medication or supportive diets which can act on the core features. So when they did this autism treatment evaluation check, there was no improvement or no significant improvement. Wherever it comes autism treatment, there is no single medication or no single diet which can treat autism. It is only modifying the features. So camel milk can cause irritability, bowel disturbances, yes, but it is only when it is given in the raw milk, consumed raw. If you pasteurize it, those things are also gradually gets better. Now, what are the advantages? I have told a lot of advantages. It is, it is lactose free. So another thing is that we can give in children who are lactose intolerant or who are not able to tolerate cow milk. Then it is casein free, and its composition is similar to that of milk, cow milk. But the important thing is that it has and vitamin C. So advantages, I have told camel milk is a better those who have cow milk allergy. Then it is very, very useful in yeast overgrowth issues. Why? Because it reduces the blood sugar levels. So along with our kids who are on autism spectrum who have these gut issues or yeast issues, it is also useful in those patients who are diabetic. That is just for a general knowledge, adult patients who are diabetic, because it can be useful in those by lowering the blood sugar levels. Other thing is that camel milk has found to be very, very useful in improving the behavioral symptoms. Now, why it is useful? We all know that camel milk is casein free. And casein, we know that it contains casein when it gets broke down in our body, in the gut, it produces what we know as casomorphin. Now, this casomorphin, because of the leaky gut, it enters into the brain through the blood in our autistic kid, and there it binds with the receptors in the brain and causes the symptoms of aggression, hyperactivity. So that is why camel milk is useful in basically reducing these hyperactivity symptoms, if not reducing, modifying. And camel milk can replace almost all types of milk. And the important downside is that the taste of the camel milk is very, sometimes it is salty, sometimes it is sour, sometimes it's creamy. So it depends upon the origin. If you get it, the American camel milk is of different taste, and if you get it from other Middle East, it is of different taste. So it depends upon the origin. It depends upon what type of camel milk we are getting from there. The downside, definitely, it is too expensive. And some of my parents have put up this concern, is there any alternative to camel milk? Because yes, definitely, it is quite expensive. It costs around 2,000 for approximately, I suppose, for 1 liter or so. And consumption of raw milk is not advised at all, which I have discussed why it is not. And so these are some of the basic things. And these things which I have told, there is a risk, especially concerning for high risk populations, pregnant women, children, and those who are immunocompromised. In those cases, we should avoid giving raw milk, but boiled milk or pasteurized camel milk is useful to all age groups. So bottom line, definitely research has shown that camel milk is better tolerated in those which have lactose intolerance. It has been found to be useful in modifying the behavioral symptoms, and always consume pasteurized or boiled camel milk. So now another controversial topic. I've taken up this slide, A2 versus A1 cow milk. Now, what is this A1 and A2 cow milk? See, when we are telling cow milk, then what is that point that whether we give A2 or A2? Cow milk means it has, cow milk means dairy. Dairy product means it has to be as casein. So why is that A1 can be given and A2 cannot be given, or A2 can be given, A1 not can be given? See, there are basically, we know that casein is a protein, and casein protein compromises about 80% of almost all the proteins which are present. Now, this casein protein, basically, it has a beta casein. It has beta casein and alpha casein. These are two components, beta and alpha casein. Now, this beta casein which is present, it is of two types, A1 and A2. So what happens? The A1 cow milk, which is the usual cow milk which we get in the dairy and everywhere, it contains basically both types. It contains both A1 and A2. So this A1 beta casein, it contains A1 and A2. Means to say, it will contain, if I tell you the ratio, it will contain 70% A1 and 70% A2. Whereas A2 beta casein is the one which contains specifically A2 only. It doesn't contain A1. That means the natural casein it doesn't contain. So as a result of which this A2 beta casein means it is free from this breakdown product of casein. Now, the casein which we call it casomorphin, that basically come from A1 casein. If we are giving 100% A2 casein, that casein A2 casein doesn't contain this casomorphin. But if we are giving the if we are giving the normal type of camel milk, it will contain 70% A1 and 30% A2. So that 30%, 70% A1 will contain this casomorphin and will cause problems. A2 is 100% A2, doesn't contain A1 casein, so there is no breakdown of casomorphin. So this is about the A2. So A2 can be given, A2 milk can be given in those children who are casein free, but evidence says that there is no such you know uh, no such correlation has been found in improving. But if we go through the parents experience, if we go through the parents experiences, they have found a lot of changes in the children. So frankly speaking, I have also found it I have also found a lot of changes when I prescribe my kids on A2 milk, and definitely their gut issues, their behavioral issues has been resolved to some extent, not completely, but definitely to some extent they have been modified. So although research is limited, evidence is limited, but it totally depends upon the parents' experiences and how the child tolerates. So I have found it to be useful. So it depends upon the parents. They can also use it depending upon how the child tolerates. So this is about the A1 and A2 cow milk peptide like B7. I have told this is basically beta casomorphin which gets breakdown. This happens in A1. So to conclude, no strong evidence of A2 cow milk benefits in autism particularly, but overall A2 is better than A1, and that totally depends upon the no concrete evidence. Their evidence is limited, so it totally depends upon the parents' experiences and the collaboration and discussion with their treating doctor. So now coming to the vitamin and minerals. Now vitamin minerals is another important topic of discussion which I have taken because there are a lot of issues and controversies which vitamin and which has. See, first thing is that vitamins as such, they are not beneficial in treating the core features of autism. So try to understand this point what I'm trying to say. In autism, a lot of research and studies have done which have found that in autism the levels of some vitamin and minerals are low. Why it is low? Because of the changes in the physiological process at the cellular level, because of oxidation stress, because of mitochondrial dysfunctions, because of physiological changes, because of low mineral densities. That is why most children of ASD, if they just fell off from the bed, they will fracture their big bones like femur, which are so strong. And recently, one of my parents, he told me that he was an hyperactive kid, and he fell down from the bed. And as a result, when he fell down from the bed, his femur was broken. Now, femur is a very strong bone; it cannot be broken just falling from the bed. So, why it has happened? Because the levels of calcium were low, the bone mineral density is low. That is why what happens? They are more prone for fractures. So, the studies have found that the levels of these vitamin minerals in autistic kids, they are low. So by supplementing these vitamin minerals in these ASD kids, what happens? The levels become equal, and the physiological changes which are occurring at the cellular levels, they become better. It's not that the vitamin minerals we keep on prescribing to every child of ASD, in spite of the levels, although are not low. It is known that about 80% of the kids who are on the spectrum, they have low vitamin mineral levels. So accordingly, we have to go for these vitamin level tests, and then accordingly we have to prescribe. So, and recently the nutritional status of ASD kids has been gaining focus in this particular area. So we will be discussing. So what about these metabolic status of the ASD kids? See, there are a lot of studies which have been done, and one of the study which was done in 2012 by Adams. And what they found that there were a lot of changes, and this metabolic disturbances were there in ASD kids. Like there were levels of vitamin B12, B6 were low. There were plasma amino acid levels were changed. Glutathione levels were low. Oxidative stress, methylation. We have discussed so many times about this redox potential, oxidative stress, and mitochondrial disorders. So these levels, methylation basically means level of B. Biomarkers of oxidative stress means glutathione in B12 and B6. So this oxidative stress is basically monitored by these B12 and B6. So what they found that the study concluded that ASD children showed significantly different nutritional metabolic status including biomarkers of amino acids, vitamin deficiencies, and oxidative stress. So if we can modify these physiological problems at the cellular level by giving these vitamins and supplementing them with minerals. So what happens? The metabolic status of ASD children gets better, and thereby we can say because these improvements occur in physiological levels, the behavioral symptoms will be improved. So at the end of that, means to say the bottom line is that we don't have to feed every children of ASD with these nutrition supplements. We have to look into these physiological causes at the cellular level, then identify what are the biomarkers which have been defective. Then accordingly, we have to prescribe these vitamin minerals. That is why I always tell that a lot of queries come on the forum, sir. What are the vitamins we should give to the child? Now, definitely, I have told that 70 to 80% kids are affected with the vitamin mineral status or the metabolic status, but doesn't mean that if I write a vitamin B12 or a B6 or say calcium to one child, that will be given in the same dose to another child. We have to depend upon the levels of deficiencies. So what are the biomarkers of oxidative stress or defective methylation? Now B12 levels. Now B12 levels, B6 levels, redox ratio. What is this? Redox ratio basically is a level of this reduced glutathione to oxidized glutathione. And this ratio, what happens? It gets altered. In oxid, this indicates that there is more oxidative stress and there is defective methylation. Other, we have seen the levels of glutathione, tryptophan, and GABA, which are affected. The GABA, we know that is an excitatory neurotransmitter. So the levels of serotonin and GABA are altered, as a result of which there are a lot of oxidative stress. Because of oxidative stress, there is hyperactivity and there are behavioral symptoms. So coming another about the calcium. Calcium is other important. It plays a very important role in transmission of nerve impulses. And there is an evidence that calcium plays a very important role in this neurotransmitter excitation. And because of this nerve excitation, what happens? The levels of calciums are low in ASD, and because of low levels of calcium, the nerves get more and more excited. Means to say, they want to grab the calcium from the body. So in order to grab that, they become very aggressive. They want to take the calcium for us. They want to take the calcium for them because the levels of calcium in the nerves is less. So each nerve fights with the other nerve to get more and more calcium. So what happens? The excitation increases. So that is why we have to supplement with the calcium so that they remain stable. The excitation levels remains low. Because when a nerve will be more excited, it will transmit the impulses more rapidly. And ultimately what happens? The impulses in the brain will shoot up more. The child will always remain in a state of aggression. He will remain in a state of confusion. He will not be able to follow one command. He will be get confused. So that is why calcium supplementation is recommended to keep the nerves in a steady state. Along with that, we have vitamin B6. We have discussed it helps in oxidative stress. It helps in methylation, and it also helps in boosting our immune system. Vitamin B6 has been proved to be very, very useful along with this magnesium or simply by giving B6. And it also helps in reducing, it also plays a very important role in altering the mood behaviors. Why? Because it helps in neurotransmission production. So B12. So see, B12 is one of the vitamins which I very much recommend. But the important thing is that B12. There are a lot of studies have been done whether the B12 have to be given sublingually, that is below the lips, below the tongue, or it has to be given in oral forms, injectable form. Now there was a doctor who was known by Dr. Newbrander. Now there is a protocol, Dr. Newbrander protocol, where we give injectable vitamin B12, that is methyl B12, in the injections in the thigh every 3 months and minimum for 12 months. And this has been found to be very, very useful. Why? Because what happens, in spite of being a normal B12 levels in our body, what happens? The process is at the physiological level at the cells. The cells are not able to take the B12 from the blood. So as a result of which, what happens? They are not able to function that properly. So because the cells are not able to take the B12 from, see, this is the blood, these are the cells. Blood, B12 is there in the blood. So what happens? But this B12 is not able to go into the cells. So what is the purpose unless and until the cells are not able to receive the B12? When they take this B12, they will function properly. They will be in the less oxidative stress. They will remove the excess materials, waste materials. They will be in a regular chain of functioning. But when the B12 level is not reaching the cells will fight with each other to grab more and more B12. So ultimately what happens? The levels of stress is high. In order to get competition for the B12 intra-competition, they want to fetch the B12 from the blood. So they will be in the state of oxidation. They will be in a state of excitation. This is what exactly happens in autism. So the levels, so the purpose is what we'll do, we will go for the blood test of B12 and the levels of B12 will be normal in the blood, and then the parents and the professional will be satisfied, yes, the B12 is normal. So still, what is the purpose of giving B12? My child is not having any of these problems. So in spite of having a normal B12, the cells will be at the fighting state to grab, because they are not able to get the B12 from the blood. So here we give injectable B12s, which we go directly. So subcutaneous injections we are giving, and this has to be given every 3 days for 12 months. And in my practice, I have given to some of the kids; they have found improvement. But the only thing is that the compliance, since it is it's a long period. It has to be given every 3 days and for 12 months, and so compliance is a big issue. Then another thing is that in some of the cases, around 20 to 30% of the cases, in the initial 5 to 6 months, there will be hyperactivity and mouthing issues. They will get worsen, but these are generally tolerable. After a period of 6 months, they get gradually settled down, and these are generally called as tolerable side effects. Sometimes they become intolerable, where they are not able to control aggression or hyperactivity and mouthing issues. In that case, we have to stop the B12 immediately. But that I have found in hardly less than 10% of the cases. As of now, in those cases which I have given B12 injections, I have not found these intolerable features as of now, by the grace of God. So, in my opinion, it is safe and it is useful in improving the socialization and improving this oxidative stress. See, if we improve this oxidative stress, improve this physiological processes, we will be able to improve this cognition, we will to improve his activities, his socialization, because all these physiological and the cellular processes are totally linked to the functional things. See, these are cellular, oxidation stress and mitochondrial dysfunction. Functional means बिहेवियर उसका अच्छा है, सोशलाइजेशन अच्छी है, बात अच्छे से करता है, कॉग्निशन अच्छा है। तो हमको करना तो यही काम है कि बच्चे को फंक्शनली अच्छा रखना है, सामने वाले को दिखना चाहिए फंक्शनली है। बट वो काम कैसे होगा? डायरेक्टली यहाँ पे आके नहीं हो सकता, स्टेप बाय स्टेप सेलुलर लेवल पे काम करेंगे, वो प्रॉपर्ली सेल्स काम करेंगे और वो आगे अपना प्रॉपर्ली फंक्शन करेंगे, तो सामने वाले को जो दिखेगा उसके बच्चे के फंक्शंस वो प्रॉपर होंगे। सो दिस इज द थिंग। Now, another thing is folic acid. Folic acid has also been proved to be very useful maintaining the new health cells and cognition, but we have to go for folic acid levels, and then accordingly we have to go that whether the child should be given folic acid. And sometimes what happens, folic acid is also prescribed in mothers during pregnancy, and we have discussed in our gut brain axis webinar that the precursors of ASD are formed well within the womb in the uterus when the child is in the uterus. And one of the reasons is that studies have shown those mothers who do not take sufficient amount of folic acid during pregnancy, the chance of ASD increases in the offsprings, or the chance of ASD increases in the newborn. So this whole process of ASD has to be started right from the conception. We have to take into points. The mother should take adequate levels of folic acid. She should take adequate levels of calcium. Whenever the gynecologist prescribe those iron tablets, they have to be taken very, very regularly, and they have to be taken very, with with very lot of sincerity. Because at that time, we will not be able to identify the harmful effects of these things. We will be able to identify only after a period of 3 to 4 years, when the parents notify that yes, at the age of 2 to 3 years, my child is not speaking, he's lagging behind, he's having some issues. I'm not telling that this is a major factor, but this is one of the factors from lot of many factors. So please, whenever we are taking these folic acid during pregnancy, the mothers, they have to be taken regularly, as it is one of the important factors in increasing the chance of ASD. Then another important thing, carnitine. Now there has been a lot of issues. What is carnitine? What is carnosine? What is carnosine? See, carnitine and carnosine are something different. Both are amino acid, but the action is different. And I have put one slide about this, which is better between carnitine and carnosine. Carnitine, we know it is carnissure, but carnosine is cognicare. Cognicare, when I use the term cognicare, most of the parents must be well aware. Yes, I am giving cognicare, because 50% of the parents are giving cognicare. So I have put a slide in cognicare, and basically means cognicare versus carnitine, which is the better. And studies have shown that carnitine helps in mitochondrial dysfunctioning, making the cell coming out from the state of oxidative stress, means providing them a smooth functioning. So this is how about the carnitine. Then another, vitamin D. Now vitamin D, we know that besides increasing the chances of fractures, and the levels of calcium are low in ASD kids. Why they are low? This is the reason is because of pig eaters. And I won't be going to the pig eating behavior, because one of the reasons why these children are more prone nutritional deficiencies, because they are very choosy. They don't like to eat everything. They eat either particular thing they will be eating a person. So that means to say the diet is not balanced. And why they are very choosy in eating particular things? It's not that their behavior. It's because of oromotor sensory issues. They have a lot of oromotor sensory issues. Some kids like to have only crunchy food. Some kids like to have only soft food. Some children like to have only a particular type of texture food, or a particular type of color food. Either some will be liking only have spinach, only green. Some will be taking only yellow. Some will not be taking yellow dal. So this is the oromotor sensory issues. So first thing, definitely these things keep on going from they go parallel. We have to work on the oromotor sensory issues. Along with that, we have to work on the vitamin deficiencies which have been occurring. So along with these fractures, vitamin D, the one of the studies has been done, and now the latest research says that there are some receptors in the brain which are for vitamin D receptors. And when vitamin D levels are low, these receptors basically they modify our behaviors, neurodevelopmental behaviors, and they may cause depression and changes the mood. That is why adequate amounts of vitamin D levels should be maintained in a normal range. And deficiency of vitamin D also promotes allergic symptoms like gut issues, hyperallergies, respiratory infections, cough and cold, adenoids. And we know that many of the ASDs, many of the kids who are on the spectrum, they have a lot of allergies, either adenoids, recurrent respiratory tract infections, or they have recurrent diarrheas. So vitamin D is useful in resolving to these issues to some extent, thereby help in improving the other factors. So another important thing I mentioned, fractures. So we go for a calcium level. The calcium level is normal. Then, sir, the calcium level is normal, vitamin D level is normal. Then why my child is prone for fractures? You told that it is due to calcium deficiency. Then why is being prone? There is a term which is known as BMD. That is body mineral density. Means to say the amount of calcium, the levels of calcium in the blood is normal, but we are concerned about the levels of calcium in the bone. The levels are there, but those levels are not able to taken up by bone. That is bone mineral density. So the amount of calcium which is present in the bones is very, very important. So that we have to do in those kids who are more prone for fractures. So B12, B6, I have discussed about this B12, about the Dr. This new Brander protocol. Then vitamin D, B6 I have discussed. Folic acid. Now folinic acid is something different. Now there is one term which is there is one of our parents are there is in the group, and we have discussed about this. Cerebral folate deficiency is basically it is basically a type of folic acid or folic acid deficiency, and where we have to prescribe with folinic acid. The levels of this folic acid in the brain are less. So as a result, these children are get diagnosed with this cerebral folate deficiency. It is a type of syndrome which is associated with ASDs. So this just to say that how important these folic acid and folinic acids are there in our kids. So folic acid, I have told that deficiency can occur in children due to insufficient amounts of folic acid in pregnancy by mothers, which I have told and discussed. And numerous defects in metabolism of folate has been linked to ASD. One of the defects which I have told is cerebral folate deficiency. So the most common, I have written on the slide also, the parents can go through it. The most common is cerebral folate deficiency. We don't have to go into the details. The purpose of this presentation is just to make you aware of the various importance of these vitamin and minerals, and more than that, how they should be prescribed. There should not be irrational use of these. There should not be overuse of these medications. They should be used rationally, selecting from child to child and deciding on his biological parameters. So the bottom line for vitamin mineral is that a lot of various studies and RCTs are basically randomized controlled trials. There are different types of trials are there: single blinded, double blinded, open blinded, closed blinded. So RCTs are considered to be the one of the best, and have shown that significant improvements in learning, cognition, and socialization with high dose of vitamin B6, folic acid supplementation, and injections of B12 every 3 days for minimum of 12 months. Now, these are generally prescribed because these are the most common deficiencies which should be definitely there in our kids. So they have to be given irrespective of the levels, and they are considered to be the the core markers of the core treatment for vitamins. Now, I have discussed about new Brander protocol. I have told you about the hyperactivity in 20% of the kids. We may get these side effects intolerable like mouthing and those. And so this is about the bottom line for vitamins and minerals. And supplementation with your sulfate, that is Epsom salt which contains magnesium, helps in improving our cognition state and also provides the body with relaxation. So this is the slide about carnitine and carnosine. So what is carnitine? Carnitine is L-carnitine. Its brand name is Carnisure. Carnosine is what we call Cognicare. See, both of them are amino acids. Carnitine is prepared from lysine and methionine, whereas carnosine is prepared from histidine and methionine. Both are amino acids. Important thing to remember is both are belong to the same group. Both are amino acids, and both basically are acting on the brain, but the function of both of them is different. Carnitine basically helps in improving the mitochondrial dysfunction. It helps in removing the waste products from the mitochondria so that the cells function smoothly. Mitochondria, just remember, it's basically an engine for the cells. If the engine is working properly, the cells will be working properly. Means to say, if a car engine is not working properly, then how can we consider that our car will be running smoothly? It will not be in a stress. Always imagine mitochondria with the engine of a car, and imagine the rest of the thing like brakes, shoe brakes, clutch, steering, smoothness with the cells of the body. So now you can imagine it will be easier for us if the mitochondria or the engine is working properly, the rest of the cells or the rest of the parts of the car will be working properly. So now we can imagine how important this carnitine is for the body or the ASD kids. The mitochondrial dysfunctioning is there. So if the mitochondria in the engine will work smoothly, definitely rest of the part will work smoothly. So this is how the importance of carnitine is there. Well, it is carnisure. It acts as an antioxidant, that is in the oxidative stress and in skeletal muscles. So, and another important thing, carnitine and carnosine both have been found to be useful in reducing the progression of loss of memory, especially in Alzheimer, where there is a loss of progression of memory. So it helps in reducing this memory. Both have been found to be improvement in behavioral functions and communication, socializing, behavioral, basically behavioral and communication. These are prescribed for cognition. So it helps in improving cognition. But the important thing is that the evidence for carnitine is better. It is in the grade B. Means to say it is better and reliable compared to carnosine, which is Cognicare. It is low and weak. There are basically three levels of evidence. Whenever we do studies and research, they are grade A, grade B, grade A. Grade C. Grade A means it is a very good evidence. Grade B, it is little low evidence. Grade C means weak evidence. So both of them don't lie in the grade A. There is not a strong evidence, but definitely yes, B and B. B is, grade B is basically it is reliable enough for us to give or to put the child on carnitine. And this was a study which was done and it was published 2009 in clinical psychiatry as well as in the Journal of Pediatric Neurology. And what they found that the studies which was compared with carnitine versus carnosine, they found that carnitine studies were much better, they were more designed better, and the level of evidence was higher for carnitine than carnosine. So this is the reason why I opt for carnitine over carnosine or Cognicare. Then you have omega-3. Omega-3, everybody knows EPA, everybody knows DHA, and everybody knows omega helps in modifying the brain functions. It helps in reducing the memory loss. It is also helps in reducing the hyperactivity. But one thing I would like to say that omega-3 has no role in giving in a normal brain function. Now the point is, line has written that no effect of consumption of omega-3 normal brain function. Now what is this normal brain function? How can you tell this child has a normal brain functioning? Suppose I am here, I am sitting, I am not in a spectrum of ASD. You are sitting, you are not in a spectrum of ASD. You are not, but does that mean you are having a normal brain function? So what is this normal brain functioning? Exactly, I don't know, frankly speaking. So no effect of consumption of omega-3 normal brain functioning, it's difficult to say. But the important thing is that omega-3 is useful, but the evidence which says for omega-3 is very weak. It is not at that great evidence that would suggest that omega-3 will definitely help, but it is the level of evidence is weak. And I would like to say that it is more with the experience of the parents which I have met that they have found to be useful in overall things. But one thing I would like to highlight, omega-3 basically comes with two forms: fish form, that is fish oil, and algae form. Now, fish oil is the animal product. Now, fish oil can cause lot of GI disturbances, constipation, diarrhea, stomach bloating. And if you go for algae, now algae is that is a plant, so it is considered to be the best source of omega-3, even better than that of fish oil. And if you opt for these algae form, that is a plant source omega-3, the chances of constipation, diarrhea, and gut issues will resolve. Now, tetrahydrobiopterin, TMG, dimethylglycine. So these are some of the important cofactors which have been involved in modifying this biosynthesis of serotonin and others. And TMG, trimethylglycine, DMG, dimethylglycine, and tetrahydrobiopterin. These three cofactors, they have not found to be any useful effects in the treatment or in modifying the features of ASD. Why I'm mentioning this? Because the current event doesn't support the use of tetrahydrobiopterin, TMG, DMG. Why? Because many of the parents, when discussing on the forum, they tell that we are giving TMG, we are giving DMG, but that may be the experience of the parents, that yes, they might be getting benefit, but in my practice, in my opinion, I have not found it to be useful and don't prescribe them also, and there is no evidence at all. There is no level of evidence, neither A, B, C, to support their role in autism. Now, oxytocin. Oxytocin is another hormone which has been now studied. Oxytocin, we know it is basically a hormone which is basically used in modifying the pregnancy features and all. But this oxytocin hormone has been, a lot of studies have been done on oxytocin, and some of the studies and doctors have prescribed. I have attended one of the conferences where they were studying about the use of this oxytocin, intranasal oxytocin in ASD kids. And this is the Indian study which was going on. It is a very large study, but it has not been completed as yet. And but let's see what the result. But as of now, there is have been found no association of giving intranasal intranasal means they give in the form of a spray in the nose, no support. So just want to give highlight this slide, that if you are coming in touch with any biomedical doctor or any other professionals who might advise you to go for an oxytocin intranasally, that this might be useful in improving the social responsive behavior or other things, I would suggest not to go for that. Melatonin. See, melatonin, yes, there is a strong evidence that melatonin helps improving the sleep disturbances, but the problem with melatonin is that the problem with sleep disturbance children is that there is the children take a lot of time to go for a sleep. That is, the lag period to go for a sleep is very high. It will help in reducing that. And another thing is that it only helps in a transient period. About 4 to 6 weeks period will be helping. Then after that, the problem will come. So the thing is that all these medications are only for a transient period. You cannot be compliant and you cannot remain complacent that yes, now I have started on melatonin, now my child's sleep will be healthier for a very long period. Or also you cannot give melatonin lifelong. See, why I have introduced this in this topic, biomedical treatment, because it is an hormone, it is not a medication. So the role of current evidence definitely support the role of melatonin, but the problem is it is only transient and it will be beneficial only for a transient period. Long term, again, you have to increase the dose, you have to titrate the dose. We generally start with, say, 1 milligram. They are also given in the form of sprays. Now, another important this medication, antioxidant, N-acetylcysteine. There is a lot of research is being going on this drug, and basically we know that in our case there is an imbalance between neurotransmitters, glutamate and GABA. Because of this, their neural disturbances, their excitatory and inhibitory transmitters are there. Because of the imbalance between this, their sleep is disturbed, their hyperactivity is disturbed, and because of that, their socialization issues occur in hyperactivity. So N-acetylcysteine has been studied in a lot of trials with good results, and it has been found to be useful. But the problem is that the studies which have been done, they are not so much that we can say yes, it has a very proven role. But in the near coming future, we might get some more studies so that we can get a concrete evidence. But I would say this is one of the medications which in future might get some benefit. In further studies, we get to develop some further studies. As of now, there is no strong current evidence to support N-acetylcysteine, and the dose varies from 600 to 1200. So the purpose is basically to get you aware of these, what are the new medications which have been going on, which have been tried, or which have been basically going under research. So role of digestive enzyme. See, digestive enzymes we have tried, and definitely digestive enzymes, they have a role because they help in modifying the gut bacteria. When they modify the gut bacteria, the brain gut brain axis improves, and ultimately the the behaviors are improved. So there were 2 to 3 RCTs which were done, and they were very large studies. One of the studies which were done with new digestion. Now, new digestion is basically digestive enzyme which is consisting of pepsin and papain, and these are one of the most important digestive enzymes which have been play a very important role. They are basically pancreatic enzymes, and so they have been found to be useful in modifying these features of gut tissues, and thereby the behavioral symptoms have been improved. So overall we can say the evidence of digestive enzyme is very good in improving the gut issues, but definitely directly affecting the core features of autism is not there. They will improve the gut issues improve it, gut brain axis improve it, so indirectly they will affect this neurobehavioral symptoms. So there is an evidence for the role of digestion. That is why I always prescribe on my biomedical plan digestive enzymes to my kids. Now flavonoids. Now these flavonoids are another important promising medication, medicine biomedical approaches which might be useful and may become a promising in a kit of biomedical treatment in near future, because the studies are not very much right now. Flavonoids are basically a plant sources, and as a result of this, why they have been considered to be a very promising alternatives in biomedical kit, because first of all they are plant sources, so chances of risk or chances of side effects are very less. And another thing is that they act as natural antioxidants. So another thing, say they will be modifying the redox potential, modifying the mitochondrial dysfunctions, and they basically come in different forms. And as such, frankly speaking, I have not tried them as such, and I'm a little hesitant to give these flavonoids to my kids as of now. But I'm just waiting that some more literature comes on flavonoids so that we get a thorough and strong evidence of this, and I'll be ready to start, because definitely I believe there are no such harmful effects for these. They are natural antioxidants and they are plant sources, so they can be considered to be a useful a part of biomedical treatment. If they don't cause much improvement, they will not cause any harm. And frankly speaking, we are giving so much things to the children. Exactly, we don't know actually that which medication or which therapy, which treatment, which thing is affecting our kids in a positive way. Probiotics. Probiotics, I won't be discussing much, and we have discussed a lot about probiotics. The a word of probiotics is that yes, probiotics are recommended, and there is evidence that probiotics help in healing the gut. These are live microorganisms. They are preferred over prebiotics like inulin, because they act on the and feed on the bad bacteria also. Then hyperbaric oxygen therapy. Now, a lot of parents are going for this HBOT or hyperbaric oxygen therapy. Now, hyperbaric oxygen therapy, what is the funda of this hyperbaric oxygen therapy? See, hyperbaric oxygen therapy was basically used to in carbon monoxide poisoning. The purpose is that they say that in autism, we know that there are some cells which are get damaged. So because they believe that those damaged cells, they get damaged because the oxygen supply is very low. So what they do in hyperbaric oxygen therapy, they give a very high pressure within the chambers to the child, and because of high pressures, 100% oxygen is given. When they give that 100% oxygen is given, and those cells which are on the verge of dying, they say that the cells have not died; they are on the verge of dying. They are dormant. When we give them oxygen, means when we give them food, they become active. So as the result, their behavioral functions, their cognition will improve. But as such, there is no current evidence. Cochrane review doesn't support this. In fact, it warns the professional parent not to use it. Why? Because we are giving very high pressure. So the chances of lung damage is there. Lung pressure chances may increase. There are chances of pressure damage, that is barotrauma. Another important thing, it is not useful in seizure children because it may aggravate seizures. Then before chelation, I will just put a word on stem cell therapy. Now, stem cell therapy by the Indian Association of Stem Cell Therapists and even by ICMR, that is Indian Council of Medical Research, they don't become stem cell therapy for autism at all. And in fact, they have chances. We have seen that those parents who are giving stem cell therapy, they have what happens? They inject the stem cell through the spinal cord, and when they inject in the spinal cord, there are chances that spinal cord or the CSF, they may get they make chances of spreading of infection of meningitis. It is of no use. So I just request parents not to go for stem cell therapy and not to be inclined by those professionals or biomedical doctors or any other developmental pediatricians encouraging the parents to go for stem cell therapy. Now, chelation. Chelation is another controversial topic where a lot of parents they are trying a lot of things for the chelation. First, I would like to say that there is no evidence at all as of now to support that heavy metals is associated with autism. The problem is that what happens, we have found that in autism, heavy metals, the levels of heavy metals are high in autistic kids. But please understand what I want to say. There has been no association between heavy metal toxicity and autism. But in autism, studies have found that the levels of lead, which is heavy metal, have been found to be high. Now, why this levels of lead is high in autistic kids? The reason is because lead is one of the heavy metals which is very much exposed. Children are very much exposed in household. So, because most of the kids of our kids who are on the spectrum, they have mouthing issues. So because of this, they'll be taking a lot of non-edible things. They'll be chewing, they'll be crunching, they'll be taking crayons in the mouth. They'll be pica, means they'll be licking non-edible things like pins and etc. Because of this, the exposure of lead is very high in the autistic kids, and as a result of this, the lead levels has been found to be high in autistic kids. So I'm just trying to extrapolate you what exactly the link is there between the lead levels and the autism. It is not related to the autism functions. It is basically retrospectively the levels of lead is high in autistic kids. So another important thing is that, and the levels are not that high in that we have to start with chelation. To start with the chelation for lead, the levels of lead should be at least more than 40 microgram. The safe level is less than 10. And there are so many parents who have come with me and have showing, sir, the hair metal analysis we have done and the levels of lead in hair have been found to be very, very high. They were so anxious, they were so worried to start in the chelation therapy. I just told them, be relaxed, don't be panicked. And when we went for the blood levels of the levels of the lead were just sometimes 4, sometimes 5, sometimes 6. So the safest levels is less than 10 microgram. Although, if I would say, ideally, even a minor exposure of lead can be harmful. But as per the guidelines, because that is not possible for kids, definitely they will have some level. Even a neurotypical kid, they have pica issues, they will be biting, they will be licking with their tongue paints. So as per the guidelines, the level of lead should be less than 10 microgram per deciliter in the blood. And when we go for those testing of those parents, the levels of lead were found to be 4 to 5. That means we don't have to do anything. There is no point in starting with these chelation therapies, especially which we are doing DMSA and injections, or they can cause damage to the kidneys. They can cause many other things. So I have written the bottom line that 2015 Cochrane review, they have found no association between ASDs and high metals. And in fact, chelation is considered to be a very high potential risk factor, means to cause harmful rather than causing improvement. So this is the reason why lead is levels high in autistic kids. So how we can prevent this exposure of lead? This is the guidelines which I have taken from the standard advisory committee who works on lead poisoning in children. So we know that, and I have written a line also that evidence does not support hair metal analysis with ASD. So please and please don't go for hair metal analysis because it has no use. I know some lab in UK, they are basically doing some of these tests, hair metal analysis along with urine for organic acids, but hair metal analysis does not have any association with ASD. If you want to actually go for the blood levels, that too for the lead, because there was an also mercury that was found to be that mercury is associated with autism. No heavy metal has been found to be associated. Only the thing is that lead, it is not associated, but it is retrospectively is that the levels of lead become high because of the mouthing issues. So what we can prevent is that we can prevent the children from taking lead-free crayons, allowing, just keeping a check. They do not lick, they do not bite non-edible things, they do not crunch or take out the paints from the walls and take them in the mouth, and don't take lipsticks or sometimes paint, pastes are there. Make sure they are lead-free, and sometimes the creams, the moisturizing creams, They are very fond of squeezing them and taking and feeling the taste of them in the mouth. So just keep a check and avoid them. Candies, spices, and they might be containing lead. So now another important controversial topic is oxalates. Now, what about oxalates? What does the evidence say? And see, oxalates are what? Oxalates are basically, they are a form of organic acids which are found in the urine. And what happens in autistic is they have found the levels of oxalates have been found to be very, very level, very, very high. A normal oxalate level, if we say, it is say 70 or less than 70. And in autistic kids, they have found the levels of urine oxalate levels have been found to be very, very high. They were more than 90. Now, more than 90 means it consists of a genetic disorder which is known as hyperoxalurias. Hyperoxalurias means the level of oxalate in the body becomes very high in the urine basically. So as a result of it, when the levels of oxalate in the body becomes high, they start coming out from the urine. So the levels of these oxalic acid in the urine will be very, very high. So as a result, they are associated with hyperoxalurias. But the important thing is that we should remember that in hyperoxaluria, which is a genetic disorder, there are other organic acids are also there which are affected. But in autism, they have found that only oxalate levels are high. Other organic acids which are should be defective in hyperoxaluria are not affected, are not defective. They are in the normal range. So that means to say that the oxalate which is coming in the body, it is from the external sources. That is why we prescribe children to go for a low oxalate levels, low oxalate foods. Now, should all the child go for low oxalate food? No, we have to go for urine for oxalate levels, and that should be done for 24 hours, or a spot urine sample has to be done. And then according to the levels, a diagnostic for hyperoxaluria, the level should be more than 90 milligrams millimoles per millimole creatinine. A normal level is less than 70. Suppose if a child is having 75, sir, iska level to high normal to 70, iska 75 start with oxalate diet. No, this is not the thing. That is why there was a query which I mentioned in the forum that every child should not start on oxalate diet. We have to be confirmed on genetic. We have to confirm a urine analysis whether it fits with the hyperoxalurias. The level which is consistent is more than 90. Is the child showing symptoms of high oxalates, that is poking the eyes or itching in the urine, rubbing the urine parts, private parts, or there is a lot of burning sensation while passing urine. If these things are there, then we do have to switch on the low oxalate diet. And research shows that around 36% of the children who are on the autism spectrum, they have this hyperoxaluria. This is not a genetic disorder. They are not diagnosed with genetic disorder because other things are not there. It simply is that they have high levels. And why they have high levels is probably because the pathway which is responsible for the breakdown of oxalate in the body is not functioning properly. Again, we are coming at the sensory level. Oxalates हैं, ये प्रॉब्लम नहीं है, बट वो बॉडी में ज्यादा है, बट वो ब्रेक डाउन नहीं हो रही. So what we have to do, we just have to reduce the amount of oxalate from our body by consuming food which are less in oxalate. But every child should not go. Only those children who have high levels. So the levels which are consistent. See, this is a graph which I have shown. These are the autistic children. If the parents are having a slide on their front, I have given on the left side autism number. They have taken 100. On the right, they are normal neurotypical kids 16. So what they found that the levels, these are the levels in urine 100, 200, 300. What they found that the levels in the autistic kids, 36% of them were having levels more than 100. That means they were in the range of hyperoxalurias. So, but whether it is disturbing the CNS symptoms, whether or not, we don't know. But yes, there is a lot of craze is going around now among professionals, among parents, that the child should be on low oxalate diet, child should be on low oxalate diet. So my idea is just to emphasize that every child should not go on a low oxalate diet, and just a high level above the normal range is not a criteria to start with a low oxalate diet. So what are the foods? I've given the most important foods which are high in oxalate. Most of the citrus fruits are high. Almonds, peanuts, and sesame foods, sesame seed, they're high in oxalates. Cashew is high. Tomato, ladyfingers, tofu, walnuts, and most of the blueberries, blackberries, and coffee and chocolate milk. So these are the natural ways how we can avoid giving how we can prevent taking high oxalates. Drink lots of fluids. Avoid taking too many citrus fruits. And non-vegetarians, they are basically at the better advantage because almost zero amount of oxalate is present in the non-vegetarian diet. Another thing is that another important thing which I have not mentioned here. Sometimes the levels of oxalate can be very, very high due to fungal issues. So try to check whether the child is having yeast overgrowth issues or not. If it is having, you have to treat for the yeast issues. And in 20 to 30% of the cases, what happens if we resolve the yeast issues, the oxalate levels will be resolved. So these are some of the other alternative therapies which I have mentioned. I have not mentioned in detail, and basically, frankly speaking, I can't tell you exactly music therapy how we have to go about it, and that we can discuss with a music therapist, because there are a lot of different therapists are there for music therapy. Audit integration therapist is there, acupuncture therapist is there, but my purpose here is to make the parents aware, yes, these therapies are working and there are strong evidence. And interestingly, music therapy has a very, very strong evidence, and it is of grade A evidence, means strong and very supportive evidence in autism in modifying the socialization behaviors. So music therapy, those parents who are giving, that's good. Those parents who are not giving, I think they should try for that. And other thing, but definitely it will not be soothing to every child. It depends from varying to child. Grade A doesn't mean that it will be 100% for every child. It varies from child to child. Some children, those may be having auditory sensory issues, they may not be suitable for that. So it's just that it depends upon the experience and depends upon which child supports this therapy or not. Then auditory integration training, it is basically a training in which we expose the person to a selective level of music by modifying his amplitude. It has not been found to be any evidence, so zero evidence. Dance movement therapy, yes, it is of grade B, and dance movement therapy has been found to be very, very useful. And in fact, we are doing dance movement therapy in our center, our Giggles Clinic and my own space. We are doing this dance movement therapy. Then acupuncture and massage therapy, it has been found to be results are mixed. Some have been found to be they have grade B, some have found to be grade C, some have found to be no grade. So it depends upon the experiences from parents to patients, but as such, no concrete evidence to support its role in ASD. Yoga, yes, yoga is a very important movement therapy, and it has been found to be grade A evidence. We are doing yoga. We have Miss Rohini ma'am with us, who is basically a special, who is basically physical therapist, and he's a MPhil in MPhil in physical education. He's, he's been associated with our panel of experts in our team, and we are doing yoga therapy regularly. And we are giving yoga to we are giving yoga to my son also under the guidance of Rohini ma'am. Plus, she's also taking sports and play therapy, which I have not mentioned. They are also of grade A evidence. Sports, and we have discussed a webinar on sports, how sports can be so much useful in modifying the gross motor and fine motor activities. We are running the sessions regularly on sports, yoga, and even the dance movement therapy. But presently, because of this COVID pandemic, we have stopped. But those parents who are interested in taking these sports at home, what they can do, they can always put up queries in our forum or in our different WhatsApp group or in the emails, and accordingly we have plans we can give accordingly. Then pet therapy. Now, pet therapy is somewhat, when I was going through this literature, I was very, what you can say, it was very interesting for me to go and see how this pet therapy is been found to be useful. They say that the use of animals in ASD relies on the hypothesis that animal movements and behaviors, they provide more predictable and repetitive, and could help the child with ASD to interpret the social cues, because our kids, they are very weak at the social cues. They are not able to find what does this person or the emotions. So these pets, because we keep in touch with the pets, we keep on rubbing their hands, we get a feeling of calmness, we get a feeling of relaxation. And so in one way or the other, it might helpful in providing the social cues, help in modifying the emotions, help to understand the emotions of others. But the level is grade B. In fact, I would say a grade B level is also sufficient enough to try and experiment these therapies. So this was about a bit about these some of the alternative therapies in ASD. And so to conclude, at the end of this slide, we have discussed so much about what are the things, what are the, definitely I would, it's definitely will not be easy for the parents to grasp all this. It's a quite difficult topic. It's a quite elaborative topic, and it's basically there are a lot of information is there on biomedical treatment, and daily you can read each and every new article. So To conclude, I have just given a lab tests that what we can go for. This is basically not for the parent that every could parent should go. It's just levels that how I proceed with my kids. Definitely for level one, any parent can go. These are the routine which I prescribe for every children. These are the normal routine tests, blood tests, kidney level tests, X-rays, vitamin levels. Specifically, which I go are B12 and B6 in the initial stage one level. Then accordingly go check for the level thyroid profile. Yes, food intolerance panel. Most of the parents must be aware with this term now. I always, whenever we discuss, I just prescribe food intolerance panel. The parent must be thinking, Dr. Lalit just prescribed food intolerance panel. So this is very important. So jokes apart, it's actually very important. Urine for organic acids, calcium, vitamin levels, B6 and B12, then urine for oxalates. This is important. If preferably, we can go for 24 hours. That is what they do. The lab people will give you a container, and the child, whenever the child passes the urine, it has to be collected in that container for 24 hours. Exactly, you should know the time from 8 to 8 or 1 to 1, whatever. And then it will be taken to the lab. In that 24-hour urine container, the amount of urine which is present in that, they will measure the level of oxalate. This is an ideal test. If not possible, you can go for a spot reading. After level one test, if taking filtering out those which are abnormal, then we go for level two specific test. That is specific metabolic disorders, yeast culture issues. Sometimes the child may have food intolerance issues, and in that we may get brewer's yeast or something. So this as a basically gives us an idea about the screening for yeast overgrowth issues. Then we go specifically for yeast culture test to confirm. Then bone mineral density, the calcium levels are low, or the child is having frequent fractures. Then oxalate levels are high. We have to work on the hyperoxaluria. What we can do, whether we go for low oxalate diet or whether we have to look for antifungals. Then redox potential. We only go for redox potential. We measure the ratio of reduced and oxidized only after going for these B12 and B6 levels if they are deficient or something. Specific amino acid testing, EEG and MRI if there are recurrent seizures, if there are sleep disturbances, if the child is not able to control. Level 3, they are highly specific when they found that yes, some genetic disorders are associated with ASD. We know that there are some genetic disorders like Prader-Willi syndrome, Rett syndrome, and fragile X and tuberous sclerosis. So these are some of the disorders which have been found to be associated. And I hope parents would be able to get some knowledge about this presentation. And now we'll be going on to the discussion. If any of the parents is having any of the queries. So now coming to the different queries. So the first one we'll be discussing, how do we know whether the kid is having yeast overgrowth? See, how do we know whether the child is having yeast overgrowth issues? We have discussed a lot of times. And first of all, we should know that the main features of autism or behavioral symptoms like hyperactivity, aggression, irritability, restlessness, they will be keep on aggravating. If the in spite of doing OT, in spite of doing sensory integration therapy, in spite of doing other therapies, or you are giving medications, or you are on GFCF diet, in spite of giving all these things along with GFCF diet, if there is no modification in his behaviors or the gut issues especially are not being resolved, or there is uncontrolled laughter, or there is excessive humming, or there is no reasons why the child is crying, or there is continuously gazing. These are some of the features. Or there is circling around the eyes, black circling around the eyes, black in circles around in the lower part of the eyes, or there is redness, frequent cough and cold. So these are the basic things. The list is endless, but these are the basic ones that indicate the child may be having yeast overgrowth issues. And the best thing, if we don't want to go into these clinical features, you can go for a food intolerance test. There we'll get a screening about, because the food intolerance test, when we go, there is about a food 200 to 250 different food panels which they test. So in that case, we will be able to identify, yes, the child is having yeast overgrowth issues. It is not a confirmatory, it will give you a screening. Then to confirm that, we have to go for the fungal culture test for stool or urine. Can we give curd to our kids? See, if the child is not intolerant to gazing, you can give the curd to the kid. If the child is intolerant to gazing, then you have to avoid giving curd. In that case, what you can give? You can give vegan curd. Now, what is this vegan curd? Vegan curd is basically a curd which is basically prepared from plant sources. Now, what are those plant sources basically? These are basically almonds, these are cashews, these are soya or coconut. So these are the different type of curds, and Now, please don't ask me how to prepare this vegan curd, because I'm not a nutritionist. So basically, I'm not a dietitian. In fact, I'm a specialist in pediatric nutrition. So you can get on the YouTube's how to prepare this vegan curd. But thing is that another important precaution you have to take. The child may be insensitive. The child may be intolerant to casein. You may switch to coconut. You may switch to almond curd. That is vegan curd. But there are 30 to 35% of the chances are there that those kids who are intolerant to casein, they might be having intolerant to almonds, that is nuts, cashews, soyas. So very, very important, before going for this vegan curd also, go for the intolerance test. That is the importance of this food intolerant test. That is why I always prescribe, go for the food intolerant test. At least you have an idea, you have a picture that what are the things my child is having intolerant to, and accordingly you can plan. Because you go for a vegan curd, there is no improvement, again you will be in a dilemma, again you will be in a problem. What is this happening? We are changing this diet, we are changing this diet. So ultimately what happens, everybody is in a state of frustration, irritability. They will stop the GFCF diet and they will start with a normal diet. See, whenever you start with a GF diet, minimum 6 months are required to get a significant change in your child. Because when you switch to a GFCF diet, there is a previous gluten and casein which is present in our body. Minimum 3 months are required to get eliminated from our diet, and after this 3 months, another 3 months are required when you switch with GFCF diet. So a total of 6 months is required to get a minimum significant change in your child. And what is that significant change? That we can feel in our child. His behavior will be settled, his gut issues will be settled, he'll be a more calm child. So can we give curd? I've answered that. Any data or evidence on Nemichek protocol? Is it advisable to go for it? See, this is what I've told. The evidence is that when we give prebiotics, that is inulin, first of all, there is no exact doses there. They have mentioned 1/4 to half. Now, what is that 1/4 to half? Does it vary from age to age? Does every child, suppose a 2-year-old child, should we give it 1/4? Should we give it half? If a 12-year-old child is there, what is the dose of inulin? Another thing is that evidence says that they're basically acting on a propionic acid. They give Nemichek, they give this rifampicin, which is basically decreases the amount of priming of the gut they give. But the problem is that the evidence say when we give probiotics, it also feeds on the prebiotic. It also feeds on the bad bacteria. So and along with the good bacteria. So what happens? Good bacteria are increasing in our body, but along with that, there is an increase in the multiplication of the prebiotics. We have discussed in detail about the ratio of this prebiotics, about the ratio of this good and bad bacteria, if you have attended my seminar on gut-brain axis. So that is why I prescribe probiotics. I prefer to give probiotics more over prebiotics, because they don't promote the bad bacteria, they promote only the good bacteria. So another thing is, my daughter was intolerant to casein and has stopped it for 2 years. Can I start now on rotation basis? Yes, definitely. The child was intolerant. You have stopped casein for 2 years. Definitely, you can start with the casein again. That is on rotation basis. Gradually, don't jump. It will be on a 3 months basis. Definitely, you can start. And because the purpose of this GFCF diet is not that we have to be intolerant. The child has to keep on this diet for lifelong. It is not allergy. It is basically an intolerance. As gradually our body gets settled, our immune system gets better, our cellular level, our body at the cellular level and physiological level gets better, we become more and more tolerant to things. So definitely you can start, and 2 years period is a very long time. And before that, I would also like to know what was the level of the casein, whether it was in a very high intolerant range, because normally we take it as less than 20. Then 20 to 40 is a moderate, or more than 40 or 50 we consider as a very high level. So I would say yes, you can start with the casein on rotation basis. So is use of Epsom salt help ASD kids? Yes, it is helpful. But if you take, but if you want to know it as a general rule, I can't tell, because as a general rule, it is not that 100% child will be affected with Epsom salt, but Epsom salt contains sulfate, which is very well known for improving our metabolic functions and cellular functions. Along with that, it contains magnesium, which helps in providing relaxation to the body. And the best time you can give Epsom salt, you dip the 1 scoop of Epsom salt. There comes in the form of crystals as well as in the powder. If it comes in the powder form, you can prepare a paste of it with the help of toothpaste or a general paste with adding a small amount of water. Best is water, and you apply on the body in the night for the child to go for a sleep. Or if you are taking the form of crystals, salt crystals, you can pour it in the water in a bathtub. A small amount measurement is given on the cap, and then accordingly you can give the bath. Definitely it will be helpful for the child the child will have a better sleep, the body will be relaxed, and will have a more calm and sound sleep. It can be given during the night time. It will be more effective. Are biomedical tests like oats available in India? Yes, they are available in India. It is available by the name urine for organic acids. See, Dr. Lalpath lab and SRL lab, they are doing these tests. Tests, metabolic available, screenings are also available. All the major tests are available in India. And Dr. Lalpath and Dr. SRL lab, they are doing the test at a very, very, all the one of the best tests they are doing, and they are available by the name urine for organic acids, not by the oats, but urine for organic acids. Then another question is there, how to reduce body heat in this summer? My son is suffering a lot. See, how to reduce the body heat, that basically depends on the thermoregulation of each individual. Sometimes some parents may be sweating. I may have also a lot of heating issues. Even I'm sitting in a fan or an AC. In spite of that, sometimes my nose has a lot of sweating issues. My drops keeps on coming. So that's basically a thermal mechanism for each and individual thing. We don't have to correlate each and everything with an autism, and that's a usual thing. And that's basically varies from child to child. So nothing major of concern is there. So you don't have to just make him, don't make him do a lot of exercises. Keep him relaxed. Make him sit in a more comfortable environment. My child have thalassemia minor. See, so what you want to know about this thalassemia minor? See, thalassemia minor, luckily the thalassemia minor won't be affecting much. The problem of concern is thalassemia major, where both the parents are thalassemia minor. See, when the child is having thalassemia minor, definitely either you must be on the minor side, or your wife must be on the minor side. So it is not of much concern. It will not be affecting the child at all during lifelong. Thalassemia major is a concern where both the parents are minor. In that case, the child have to be keep on switching. The every 3 months, the blood has to be given to maintain the blood levels above. That can cause problems to the ASD kids, because it can aggravate anemia and other symptoms. But thalassemia minor as such will not affect any. It will be like just a neurotypical child if we forget about autism. So it won't worsen the features of autism. But just keep a check of iron and iron levels and ferritin levels every 3 to 6 months. I would suggest every 6 months. Uh, what can be given for inducing speech? There is no such medicine, there is no such drug, there is no such thing which can directly affect on the speech. See, all those medications, all therapies which we are doing, they are basically indirectly affect the speech. See, for the speech to come, you should have a basic prerequisites. And I'm not an expert on this. Dr. Neha, who is an oral placement therapist, she can guide you even better. But as per my knowledge, the basic prerequisites for the speech is that the child should have imitation. Imitation is very, very important. Verbal imitation. The child should have vocalization. The child should have the lip closure. He should have the ability to suck, blow, swallow, and keep air in his mouth. So these are the basic prerequisites. And another thing is that he should have the sounds of ma, ba. They are basically 15 sounds are there. The child should have at least those sounds. Unless and until these things are not there, the first and the foremost thing, imitation. And I have released my video on imitation and joint attention, how important it is. It is available on the YouTube. You can go through it. These are the fundamental basis for every child. Forget about autism, forget about neurotypical. It is the fundamental for every child to develop socialization, behavior, speech, and nowadays we are not focusing on these basic fundamentals of imitation. We are more focusing on targets. A child of 4 year, इसको ये नहीं आता, इसको ये कराना है, इसको ये कराना है. We are putting the child on rote memory. आप देखेंगे एक 10 साल का बच्चा आपको पूरी हिस्ट्री का लिटरेचर सुना देगा, आपको पूरे राइम सुना देगा, बट जब उसको ग्रीट करना आता है, हेलो बच्चा, हाउ आर यू, इधर उधर देखेगा, ऐसे देखेगा, उसको पता ही नहीं है, उसको नहीं पता रेस्टोरेंट में कैसे बैठना है, उसको नहीं पता थिएटर में कैसे बिहेव करना है. Why? Because we have not worked on these basic parameters of imitation, joint attention, eye contact. These are very, very important. अगर ये चीजें हम अचीव कर लेंगे, हमारे बच्चों का behaviors of socialization 70% resolve हो जाएगा. This is guaranteed. But it is not to be blamed the parents or the professionals or the therapists. It's the thing is that the things have become nowadays, like because of the pressure, academic pressure, because of the peer pressure, because of the family pressure, and because of the social media pressure. मेरे बच्चे ने आज ये देखो ये कर लिया, पेरेंट को लगेगा अरे इसने ये कर लिया, मेरे बच्चा तो इतना पीछे है, इसको 20 तक काउंटिंग कर लेता है, इसको तो एक 10 तक भी नहीं आती, रटवाओ करवाओ. But please don't forget, work on these, take utilize this COVID period 19, keep your child focused, play with them, interact with them, do lot of play therapies, interact with them, use whatever they want in a structural way, so that they develop eye contact, they develop vocalization. And other than this, therapists, professionals are there to help you. We can guide you, but the nourishment has to be taken from the home. Please explain about melatonin and hormonal treatment. See, melatonin I have explained. We have explained about melatonin in my sleep disturbances. If you want to get more detail about melatonin, you can take my. We have given a webinar on sleep disturbances in autism. Melatonin role is only in sleep disturbances. There is no other role of melatonin. It doesn't affect of any other parameter of autism. It only affects sleep disturbances. So if you want to discuss the detail about melatonin, you can take my webinar link. We can share you. It's a paid webinar. There is a study material also. You can, everything is mentioned about melatonin. But for your information, I just can tell you, melatonin is basically a hormonal therapy. It is given in the form of sprays to reduce the time taken for the child to go for a sleep. Because we know if a neurotypical child sleeps in 5 to 10 minutes, our kid who has done lot of physical activities, 5 to 6 hours की aggressive OT कर ली, hyperactive sports कर लिया, उसके बाद भी उसको सोने के लिए 3 घंटे लगते हैं. Why? Because there is a disturbance in REM sleep, which we call rapid eye movement. So वो चीज resolve होने के लिए we give we give this what we call melatonin. But problem is that transiently उसको improvement आ जाएगा, but over a longer period of time again it will become dose dependent. So this is the thing. So another my dad has intolerance to casein and gluten and is on GFCF diet for 3 years. Is it safe to reintroduce now to do? Yes, you can do it, but again, the important thing is that we should know what were the levels of gluten and casein, whether they were very high, whether they were on intolerant levels, whether they were high intolerant or what. But since the child was on GFCF diet of 3 years, definitely I can advise you that yes, you can reintroduce it, but on rotation basis, that is every 2 to 3 months, you can introduce every 3 months, minimum 3 months or 3 to 4 months. Sorry, sorry, it is for Mr. Abhishek Jain. I could not understand your question. What is pathway? What is that? Could you please elaborate more on this? See, food reflexology, will it be beneficial? Sorry, I can't comment on that because I would search for the literature, but as of now, I can't comment on that because I have not found any such literature on food reflexology. But I can suggest you that since food reflexology is a type of massage therapy, and the massage therapy has some evidence on that, so it's a mixed evidence. So definitely it varies from the experience of the parents and as well as from the experience of the child, from the how he responses to that. But yes, it can be beneficial, but how beneficial and how fruitful it can be varies from the experiences and from the child to child, because as such there is no there are very little therapies in autism where we can say there is 100% evidence and we are confirmed yes ये तो हर बच्चे में apply होगा. My child is suffering from stress and is banging her head, biting due to lockdown and unable to communicate her needs. Can I start B6 and B12 supplementation? See, again, first of all, we should know the reason. See, I have told we should not immediately start with this B6 and B12. Yes, to some extent they will be helping, but in that case, I think it is more of his frustration because he's not able to communicate. Because he's not able to communicate, he is expressing his behavior in the form of aggression, that is by banging his head. So first of all, we should identify the thing. You know, there is whenever we approach a behavior in a child, there is we follow a path ABC. That is antecedent. That is just before the behavior. What was the environment with the child? And behavior means what did the how the he be expressed the behavior, and the C we say after the behavior how the child felt. So in that case I can simply say because he's not able to express, suppose उसको पानी चाहिए वो नहीं बोल पा रहा, तो what happens, वो अपना सिर बैंग करता है. अब बैंग करने के बाद क्या होता है, मदर उसको पानी दे देती है या वो चिल्लाता है तो पूछती है, मिल जाता है जो भी होता है. सो मीन्स टू से वो शांत हो जाता है. तो दैट इज बेसिकली हिज फॉर्म ऑफ एक्सप्रेशन, his form of communication. So I would suggest Mr. Ashwani that you work on his behavioral part, you work on his needs, try to work with him politely, work on his features that why he's not able to express, work on the environment, make the environment more settled. And yes, then you can start with B6 and B12, it will be helpful. But if I would say that only starting with B6, B12 will immediately help in communication, no, because here the reason for communication is something different. His inability to speak is coming in the form of his behaviors. So work on those factors. Along with that, you can start with B6 and B12. So gradually working on all these parameters, improvement will be there. Will GFCF diet helps in speech? Again, it's a direct question. In autism, there is no thing I can say, yes, it will help, yes, it will not help. It's a mixed picture. Everywhere we have to, we have to fight with, we have to work on this disease from all the four corners of the room. So as a result, if you work on the GFCF diet, yes, gluten and casein issues are there, they'll be reduced. ब्रेन में वो जाएंगे नहीं, एक्टिवेट नहीं होंगे, तो हाइपर एक्टिव इरिटेबिलिटी, आई कांटेक्ट बेटर होगा, तो बच्चा हमारी बात सुनेगा, आई कांटेक्ट बेटर होगा, इमिटेशन बेटर होगा, तो इनडायरेक्टली हमारा स्पीच बेटर होगा. दिस इज हाउ इट वर्क्स. सो अगर मैं डायरेक्टली बोलो क्या वो जाके स्पीच सेंटर को स्टिमुलेट करके बच्चे के स्पीच करवा देगा, वी कांट से. नोबडी नोस. इन फैक्ट देयर इज नो सच थिंग आल्सो. No, betanoids clay doesn't help in reducing metal toxicity. Any suggestion from where we should get for gluten intolerance test? Yes, you can go for Dr. Lalpath lab, you can go for Dr. SR lab. They're available all over India. It's available in Hyderabad, it's available in Mumbai, everywhere. Even if you are staying in a city or where these labs are not available, you can go for the franchisees or the small, what do you call, blood collection centers. They will send it to the higher metropolitan cities or to the Delhis, because most of the tests, SRL labs or the Lalpath, they are sending the test to the Delhis, and from here the reports are being generated, and within 3 to 4 days it will be couriered to you, or it will be mailed to your email, soft copy. It's difficult to tell. I'm using Nootropill, and the Nootropill causes stress. Earlier, I used to use Cognicare. That time, she's not stressed. See, it can depend. I have, frankly speaking, I have not tried Nootropill, but sometimes it may. I have given L-carnitine, and the results with L-carnitine are I found, and with the experience of the parents, they are much better compared to Cognicare. I don't go for Cognicare. I more prefer to give L-carnitine. Please let me know the brand names of vitamin B6 and B12. See, there are a lot of brand names which are coming with the name. Important thing is that just as I have told you, just by telling you the brand name of B6 and B12 won't be effective. We should know the age of the child. We should know the age of the child. We should know the weight of the child. We should know his intolerance level. We should know the levels of B6 and B12. Then accordingly we can prescribe. I'm again emphasizing on this. My lecture is not that every child should start with B12 and B12. My lecture is to stratify, to select. Yes, my child is having these issues, so I should go for the levels, and then accordingly, as per his age or weight, we can start giving in consultation. Because I also won't suggest you that immediately after listening to this lecture and you think a miracle will happen by starting with B6, B12. No. The purpose is to highlight you the importance of these things, and highlight the importance of going for the test, and then accordingly we can start with these B6 and B12s. We listen about biomedic treatment open pathway. What is that? Any suggestion? We listen about biomedic treatment open pathway. What is that? Sorry, I don't know about this biomedic treatment open pathway. And if you know, you could please let me know. You can share me the details about this. And open pathway, that means there must be some closed pathway also. So you can share me the details. I have no idea about this open pathway. Any suggestion to reduce the mouthing issues in kid? See, mouthing issues in kids happen when they have oromotor sensory issues. I have told they like more crunchy food to take, they take non-edible things to take, they may be hypersensitive, or they may be sensory seeking, they may be hypersensitive. And if you have attended the webinar by Dr. Neha on sensory addressing orosensory issues, then you must have understood that how what all the things are there. And to reduce these mouthing issues, firstly you should have to work on his orosensory issues. That's the thing I can tell. Then accordingly we can work on the things that which levels are less and less. But to reduce the mouthing issues, you have to work on his oromotor sensory issues. Other than that, you have to look into the causes of iron and calcium, because iron levels, they cause history of pica and they can cause mouthing issues. To go for the levels of testing for iron from my point of view. Good evening, sir. My son is non now from Good evening. Now from this year he started speaking ma, pa, ba and few words. Could be able to speak normal way or not? Could he be able to speak normal way or not? See, ma'am, this is very difficult to tell. Firstly, autism is not anything which is abnormal. It is basically it is basically a neurodiversity of the brain. Although the definition says it's a neurodevelopmental disorder, but I say it is a neurodiversity of the brain. We used to say the way the child looks into the world is different. See, when a current flows from A, B, C, this is the usual pathway. From circuit A will go to B, from circuit B it will go to C. But what happens in autism? From A will go to C, then it will come to B. So the circuit is different. So we can't correct it. Only thing we can correct it is by giving repetitive, repetitive words, repetitive instructions, commands, so that you understand, yes, the current has to flow from A to B, C. This is the right pathway. And the incidence of non-verbal autism is 25%. Mean to say, 25% of the kids who are on autism spectrum, they are mute. Means they will not speak at all lifetime. Only 25%. Uh, Only 25% is actually not only, it's quite high, because those parents who are facing this struggle of non-verbal issues, for them it is almost 100%. So this is the just for the knowledge point that 25% kids have mutism issues. But the problem, but the thing is that since your child has started working, started speaking on ma, pa, ba, you keep on working on these issues. You keep on working on his imitation skills. Keep on working on his exercises. Get in touch with the oromotor sensory expert. You can get in touch with Dr. Neha, or if you are in touch with some other persons who is having knowledge of these oromotor sensory issues, or is having the knowledge of speech and articulation issues, you can work on that. But from my side, I would advise you, keep working on the speech, keep working on the oromotors, keep working on the OTs, and look into the sensory issues. Can we give ghee to the kids? As you mentioned, raw butter is 99% casein. Yes, ghee you can give. You can very easily give ghee. Ghee is 99% casein free. There is no problem. Ghee is in fact actually very good. And should we go for food intolerant test again? We did last test in February 2018. Yes, you can give. We will get a better idea about the levels. So I think I have answered most of the queries, and now now we'll be closing the session, and almost we have crossed more than 1 hour 30 minutes. So we'll be now wrapping up the session. Another 1 to 2 minutes I'm waiting if the parents are having any other questions. Otherwise, we'll be closing up the session now. And if any of the parents are having any doubts, we can discuss it. We'll be you can discuss it, or if you are heavy, you want to take any consultation, you want to take any advice, you want to take any biomedical plan, we are providing online. We are providing to the parents, and you can just drop us an email at gigglesclinics@gmail.com, or most of the parents must be in our group. we have three different, four different groups, then we can discuss with that. Yes, sir, if we share the test results with you, we'll be able to guide you through the intolerance. Yes, we can guide you through the intolerance levels. Yes, definitely. Sure. Thank you, parents. Thank you for listening. I hope it was a useful webinar for all of us, including me. As also, I have also gained a lot of knowledge, interaction, getting interacted with you. So it's just a matter of interaction with each other and spreading knowledge and sharing knowledge. Thank you, parents. Thank you a lot. God bless you. Take care.